Hi everybody, Dr. Cary Yurkiw here. I'm a chiropractor in Kelowna. Today I'm going to be going over simple stretches for the shoulder. I call these level 1 stretches because most people come to the clinic, they're in pain, they usually have a rotator cuff issue in their shoulder, they have a hard time lifting their arm up sideways or forwards, and there's a pinching feeling either in the front here where the supraspinatus and the bicep tendon insert, or sometimes in the back part where it turns around or curls around into the shoulder. Remember, the shoulder has a ball and socket, and if that ball and socket's not working right, it can pinch the tissues in there, and that can cause irritation of the ligaments, it can cause swelling in the joint, it can affect tendons like the biceps and supraspinatus. So after I initially assess the patient and I start to treat them, I'll start to add in stretches, and I have 3 levels of them. Today I'm going to go over level 1. These are basic stretches the patient can do to help maintain the changes we're making in the clinic. So I'm going to switch screens here, and this one is a very good one where you can just have your arm hanging down, brace yourself on a table like this, and just make a circular motion one way and then the other way. I would do 5 to 10 rotations one way, 5 to 10 the other way. Now you can start with small circles and then make them bigger. You can also do a figure 8, like an 8 type of motion, and make that figure 8 bigger as you do this. Be careful to keep a neutral spine so you don't hurt your back. And you can start to add in some weight as the days progress. So you can get a soup can, hold on to that. Then you can get a barbell, let's say 2 pounds, 3 pounds, 5 pounds, 10 pounds, and increase the weight as time goes on. But do talk to your health professional about this before you do these exercises, because you want to make sure it's right for your condition. So those circles, I would do 5 to 10 one way, 5 to 10 the other way, and I would do 3 sets of that. So take a break, do another set, and then do those again, and the third time. So 3 sets of that. Okay, I'm just going to switch over to my next slide. Let's see if I can get that up here. I might have expanded this and lost my ability to see the images. Okay, this is the next one. Now, some people can do this sitting in a chair, raising both arms overhead with the hands interlaced like this. Some people are too weak to do that, so you'll have to lie on the floor and then gently raise your arms up over your head and then allow gravity to bring them down. Go as far as you can without feeling a sharp pain or any type of a strong burning sensation. If you feel that, then stop and let your healthcare professional know. So try to get the arms overhead and just rest them on the floor like that for about 5 seconds. Take your time doing this movement. Go back to neutral, which is forwards again on in front of your body, and then raise those arms up over your head again. Do this 3 to 5 times. Okay, so that's another good one. And then I think I have one more for you guys. Yeah. The floor angels. Floor angels are like snow angels, but on the floor in your home. You're going to have your arms out at a 90-degree angle at the elbows like that. You just want to raise the arms up overhead, sliding them on the ground so that the fingers touch each other up here above your head. So you're doing this snow angel type of movement, but you're doing this on the floor. The reason you're doing it on the floor is gravity helps you to keep your arms down, which is actually good for what we want to accomplish in the clinic. And then you're going to move your arms along the floor slowly until you can touch your hands together like that, and then back down. I would do 5 to 10 repetitions of this, take a break, do 3 sets of this. So you've got the 3 exercises, this one, and then you have this one, and then you have this one right here. So that's a good way to get started. Start with once a day doing these, and then you can graduate to twice. I usually say to patients, do this first thing in the morning when you get up, and then just before bed. Those are good times to do them. Do consult with your health professional. If you're seeing me in the clinic, talk to me about it. Just want to make sure it's going well, you're doing the right thing. And if you're new and you're looking for a chiropractor in Kelowna, we are accepting new patients. You can click on the link in the show notes and then book an appointment there. I look forward to seeing you guys at the next video or your next appointment in the clinic.